That's an increase of 44 from this time last week. That includes 175 deaths in Peoria County, an increase of 22. Tazewell County at 145, an increase of 12, and Woodford County at 42, an increase of 10. In regards to our probable and confirmed cases, we now sit at 24,500, which is an increase of 1,952 from the prior week. That includes 906 new cases in Peoria County, 773 new cases in Tazewell County, and 0.3% are hospitalized. Our 7-day average in the Tri-County continues to slowly decrease. We're now averaging 279 new cases daily amongst the 3 counties. And for our hospital systems, which includes OSF St. Francis Medical Center, UniPoint Health, Proctor, Pekin, and Methodist, they are both steady for the past 2 weeks in terms of their ICU capacity and their med surge, both having a 14-day average of 50 ICU beds in use and roughly 135 med-surg beds in use. Today, they are reporting 134 med-surg beds in use and 49 ICU beds in use, and reporting 1 death in the past 24 hours. What this overall means is that the hard work we talked about during Thanksgiving has paid off. We're starting to see a lot of our cases decreasing, transmission rates going down, and that's further seen by the fact that Region 2 for the past 10 days has seen our positivity drop under 12%, as well as the capacity of our healthcare systems increasing over 20%, and those patients with COVID-19 hospitalized continues to decrease. But that also marks the fact that we are entering more of the holiday season. With Hanukkah ending on December 18th, we now transition to Christmas on the 25th, and Kwanzaa begins on the 26th. And then we enter straight into the new year. So a lot of the guidance we shared around Thanksgiving, we wanted to make sure our community is continuing that practice. Social distancing. It's important that if you celebrate in new ways. Look at virtual holidays and gatherings. Again, wear a face mask, as well as practice good hygiene, and if you haven't already done so, get your flu vaccine. And if you haven't already done so and you are eligible, get your COVID vaccine. We had some great news this past week. And to share more of that and the fact that we were able to vaccinate 1,801 individuals in our hospital systems is Jennifer Hopwood, Chief Nursing Officer for OSF Healthcare.
Thank you, Monica. As Monica shared, last week marked, I believe, the beginning of the end of this pandemic when our community received our first shipment of the Pfizer vaccine. We were able to start vaccinating our frontline healthcare workers, which is the initial phase of the state's plan for vaccination to stabilize our healthcare system. At OSF St. Francis Medical Center and our surrounding OSF locations in Peoria, we were able to vaccinate about 10% of our workforce that comes into contact with patients. During that time, or during the vaccination phase, the whole process went very smoothly. Many of you are aware that Pfizer has some restrictions on how many days it's good for once it's taken out of cold storage. It has to be used within 5 days. At OSF, we were able to vaccinate using all of the doses that we were allocated with none wasted well before that 5-day mark was hit. We saw no individuals with significant reactions to the vaccine, and overall the process went very smoothly. I just appreciate the collaboration that the Tri-County health departments offered to the health systems. Their collaboration with combining their doses and distributing them to the local healthcare systems has really helped to ensure that we are able to provide ongoing resources to those patients who are the most ill with COVID-like illness. As Monica shared, our numbers remain somewhat flat for hospitalized COVID cases, and we're able to currently provide support to the patients who are ill with COVID illness right now. However, if we don't continue our current practices, we could be in a very different situation where we would not be able to meet the demand of our community if we saw an increased incidence. I'll just stress the message that Monica shared, encouraging to only limit your contact with those who are in your household for your holiday gatherings. Consider things like virtual events. Make sure that you're wearing a face covering when you're out in public and around other people, making sure that you're social distancing, and making sure that we're washing our hands. Those things right now are the best defense against COVID illness in our community. I'm open to any questions that you may have at this time.
With the Moderna vaccine being shipped out earlier this week, do you guys have an idea of how many doses of that you'll get and what the distribution for that within conjunction of the Pfizer vaccine will look like going forward?
Yeah, so we have received initial numbers for the Moderna vaccine to be distributed. We're just now sharing those within our local healthcare system now. And at this point, I'm not going to divulge the exact number of the doses, only that it is a large shipment, and it will come directly from Moderna to our healthcare system. So that was something that with the Pfizer vaccine, it was made to the disaster center, and we have to put that into cold store. We had to take it out of cold storage. So when we're kind of cutting out the middleman with the transportation of it.
So has a new shipment of vaccine arrived after last week? Will the new one come this week?
No, we don't have shipping confirmation as of yet.
Okay, so that 1,800 is all from last week's shipment?
Correct.
Are you currently still vaccinating, or have you used everything up now?
Everything's been used up because it came out of cold storage on we had 2 different shipments last week. One came on Tuesday, one came on Wednesday. The cold storage that came out on Tuesday had to be used by Saturday. What came out of cold storage on Wednesday had to be used by Sunday.
When are you expecting the Moderna? Do you know? No idea.
It's kind of like my Amazon package. Your guess is as good as mine.
Now the next shipment of vaccines, do you know, are you expecting that this week with the Christmas holiday this week?
I'm hopeful, cautiously optimistic, and planning for the fact that it may arrive.
And among the 1,800, do you know what the rough split is between how many OSF got, how many Unity Point got?
Yeah, am I okay to share? Yeah, so we really looked at the incidence of COVID illness within our hospital systems to determine the split of the initial shipment. And so 2/3 went to OSF and 1/3 went to Unity Point. So OSF, St. Francis Medical Center, received 1,140 doses. You may have heard on the news last week that we were also instructed that we could start pulling a 6th dose if there was extra doses available in the vial. Some had extra doses, some did not.
Thank you.
And I also appreciate the fact that both OSF and Union Point have been working with our Tri-County tirelessly to make sure that as we allocate those vaccines, that they're able to be distributed quickly. 2 things I do want to highlight before we close out our meeting is, one, next week the Federal Retail Pharmacy Partnership will also begin as well. This will actually allow for direct shipment of vaccine to our long-term care facilities. We had worked throughout October and in November to make sure our long-term care facilities that were eligible were registered. We did get the final report from the state as well as the CDC. None of our local entities were disqualified at all, so that means everyone that registered is on the program, and so we hopefully will have vaccine in our long-term care facilities beginning on the 28th as well. Likewise, there was guidance from the Centers for Disease Control and Prevention as well as ACIP on the different phases. And I want to reiterate that there's a lot of excitement about the vaccine, but as Jennifer mentioned, there's still limited values and we're still working on that healthcare worker group. Only 10% of OSF with direct patient contact has been vaccinated. There is still a lot more work to be done. So with that, there is within phase 1, which we are right now in as part of vaccine, there are 3 tiers. The first one is healthcare professionals. That includes direct and indirect patient care. So think of dietary or custodial staff that may be working in those spaces. The second tier, 1B, will be our frontline essential workers, as well as persons older, 75 years and older. And then we will move into 1C, which would be the remainder of our essential workers, as well as persons between the ages of 65 and 74, and individuals between 16 and 64 with high-risk medical conditions. Now, this is still going to be vetted. We do know that the Illinois Department of Public Health will even go additional, have criteria listed on here, and we hope that that will be part of their next version of the IDPH vaccine distribution plan that's available off of their website, and that will be version 4.0. As Jennifer mentioned, we are really hopeful to get the vaccine of Moderna sometime in the next few days. And then again, the turnaround is that even with the holiday season, those individuals that are in that first tier of 1A, they recognize the value and the need for this vaccine. And so we expect a quick turnaround with this vaccine as well. So with that, I'll open up to questions.
Will nursing home vaccinations start this week if that comes in?
So we believe the nursing home program will actually begin on the 28th. Okay.
With, what you mentioned earlier, the 7-day positivity rate and all those are in the green for region 2. Will we see restrictions lifted moving forward, or is it still too early to tell?
I believe it's still too early to tell. I think that seeing that Region 2 and other regions in our state are moving in the right direction is a good sign. But we still have a lot of work ahead of us, especially as we're about to enter that final part of the holiday season where we can expect to see, again, possible gatherings and further transfer of the virus. So the mitigations are in are in place and will continue to be so as we kind of see how we filter out past the new year and get to a point where we feel like we're stabilized, as well as, again, once we get a lot more vaccine in our community, how we can get out of those mitigation levels.
This question might be a little premature, but just at what point does IDPH determine that 1A, that healthcare sector, has been, gone through the whole vaccination process and it's time to move on to that next tier of essential workers? I mean, how do you quantify that?
So the question is, when do we feel that we've got a handle on the 1A healthcare workers to move into the 1B and subsequent? So there's a lot of data points that need to be collected. So for example, one region might be able to get their 1A workers fully vaccinated rather quickly, but another part of our state is still having issues just by volume to get the number of healthcare workers in that area to be that. So what is happening with our hospital systems is that they're providing a lot of data to the state. They're providing a breakdown by county, by number of healthcare workers, so that if we need to redistribute that 1A in subsequent weeks to make sure we cover 1A across the board, that's going to be the next step. But we are very hopeful that, we have seen a large push coming this week of the Moderna, and that if we have those subsequent weeks, that we can move forward and get to 1B and then down to 1C and keep moving in that direction.
Do you know which local long-term care facilities are scheduled to give the Moderna vaccine?
Right now, all of our long-term care facilities actually registered for the CDC program for the federal distribution, and all of them qualified. I don't know which order or the schedule, but they are starting on the 28th, the release of the program.
And it's within the nursing homes that they're deciding who gets it first, right?
So the way it is registered in the nursing homes is that they provided that data to the CDC, and they're going to start allocating it across the board. They're hoping to get the full vaccine needed for their full staff and residents. Some might get partial, but the nursing homes have been working through plans to prioritize in their own entities if they don't receive their full allocation.
Does it include assisted living people who have their own apartments, but they're older, they're at risk as well?
So the question is about assisted living. I don't know if those sites, it depends on how they are licensed. That's going to be really that dictates it. I know a lot of our independent living facilities are not necessarily qualifying for those programs, but the state's actually working through a different avenue to address that.
And with the second vaccine being approved, is there any better estimate on when the general public will get it?
So the question is when we will get to that phase where it's be really open to the general public. I think we're hoping sometime in, the spring and the summer. And by then, we also hope that you're going to see this vaccine in a lot of locations, such as pharmacies, groceries, not only your primary care provider. And so, don't be surprised if you go to Kroger one day and you're able to get your COVID vaccine.
Here's a question kind of left field. The UK, they've had kind of this new strain of COVID that they say is up to 70% more contagious. I mean, at this point, are you on your IDPH calls and your colleagues across the state talking about this new strain and probably an if or when this does come to the U.S., what the action plan is?
So the question is about the mutation that happened in Britain or the UK regarding their COVID virus. So it's not surprising. Viruses in general mutate. Coronavirus tend to be a little bit more stable than other families of virus, but it's not unheard of. The fact that it is still highly contagious, a lot of the same aspects that we are doing is going to be what we'd ask people to do and adhere to in a stricter way, of course. Social distancing, wearing face masks, and that hygiene. Those are going to be the same things to combat even this new variation of the virus. What has been, I think, tentatively the good news is that we're not seeing any issues with the vaccine. So the vaccine is still effective with this new variants. But again, we are still gearing up our vaccine program and still taking care of people that have COVID in our hospital system. So the biggest concern is that will this mutation lead to an increase in terms of the rate at which hospitalizations and ICU usage happens. So again, you can't go wrong with those 3 W's. Wash your hands, watch your distance, and wear a mask. Well, with that, I hope everyone has a very safe holiday season and stay healthy. We will resume our next briefing on Tuesday when we return. Thank you.